talk, and now we have Professor Dr. Mahipal Sachdev, and he'll be talking on intermediate vision benefit with higher spectacle independence.
Thank you very much, Sonu, and thanks for having me in this particular session. Can I have my slides, please? Yeah. So I'll be talking about intermediate vision, which we have to just discuss as to what it is. And as we are looking at in this particular session of discussion, what are the options that we have got apart from what has been talked about just before me, that is the geometric, which is the trifocal lens, or you have the EDOF, or what you have the monofocal lenses. Is there anything else that is available? And this has been the terminology that has come today is called as the enhanced monofocal or the monofocal plus. What are the outcomes of this particular lens, and what are the needs, and what are the clinical experiences that we have had at Center for Sight? So the monofocal options that are available today is that you came up with the foldable lenses. Obviously, the non-foldable went on to the foldable, and then within the foldable lenses, the optical properties, apart from the physical properties of being a three-piece lens, went on to a single-piece lens, and then you looked at the optical properties, and which are, you had all the lenses that were coming to you were the aspheric monofocal lens. From the aspheric monofocal lens, we went on to a new concept which is called as the aspheric lens or the negative aspheric lens. So that is what it is. So the companies have tried to get onto as to what is the asphericity that you need to correct. And I think the jury is still out whether you want a zero asphericity or you want something which needs to be at what particular level of correction that is there. So current day monofocal, let's look at what are their limitations. The present limitations that are there in the current monofocal is that they give you good crisp vision for distance vision, but the intermediate vision is flawed, as also the near vision is flawed. Now, as you know that the present lifestyle, if you go on to anybody, the iPhone always throws up the number of hours that you spend per day on the iPhone, and whether you are up from the last week or what. So it depends whether you are 6 hours or 4 hours or 8 hours, but you are there, and then you have the computer which is there. So the lifestyle has changed significantly, and we are today, I would say, also from becoming just couch potatoes looking at televisions, we are now looking at the phones, whether we are in the railway or whether we are in on the dais or wherever we are. So that's what we are looking. So let us understand as to the need. So the need, therefore, is that the foldable lens, you went on to the spherical, the aspheric, and then you have the enhanced monofocal. And what the enhanced monofocal is doing is trying to get you this kind of vision, because this is what you are using majority of the time. So you are either looking at the distance or you are looking at something which is nearby, which is the computer, etc. So that is where you need. So intermediate vision today is very, very important for an individual, even if you are driving, though you are getting now Teslas and all, which are going to be AI driven, but still you need to look at the speed board, etc., and see as to what it is, or maybe the Google map is going to tell you where to go or where not to go. So the new lens on the table, which is there, we were all aware of the Vivinex lens, which has the aspheric surface for spherical correction, etc., which were tolerant to coma. It was tailored to, this new lens was tailored to give you some amount of intermediate vision which is there. Now it has the same hydrophobic acrylic material which one is used to. It is glycerin free, there is no opacification, C-loop 13 millimeter, full 6 millimeters optic, low PCO that you get with outstanding rotational stability. So the problem just now today is that the Impress, which is the lens that has been launched, does not come in the toric variety. I don't know when the toric variety is going to be available, but toric ka vara hai iska, pata nahi. Okay. So anyway, I think that is the only pitfall that you have, that obviously it's a registration process. I think that's about it. And this is what we are. You can easily push it through a very small incision which is there. So this is how the lens looks. Obviously proprietary, but what they say is that they have done something on the central 2 millimeters, which is a smooth combination, and maybe they have induced some amount of abrasion which is there on the aspheric surface. But the rest of the lens, apart from this 2 millimeters, you can see this is the central zone which they have played with. The rest of the surface is just about the same which you have in their Vivinex lens, which is the monofocal lens. So what they have done is that there is a range of focus. So it's quite similar to maybe saying that a EDOF lens, but there are no rings in the lens. That is the main thing, and it is only confined to the central 2 millimeters, which is giving you a certain depth of focus. So this is what the lens has. So this is a standard negative asphericity. This is the 2 millimeter, and this is the anterior IOL surface which has the bump. So this is what they have done on the lens, and what it actually does is that it adds about 1.1 line. So this is the standard monofocal. You see that there is a strong decay that you have for the intermediate and the near vision. But when you go on with the monofocal plus, this is how the decay curve looks, and you can actually look at 1.5 diopters of defocus that the patient is able to withstand. This is the multi-cert injector which you have, which you are all aware of. Just to show you a small video, the ease of insertion, you can see this is the viscoelastic that is being put into the lens. The cartridge that goes in, this is a patient with the iris retractors. That's the lens which is going in. You can see, and round capsular axis goes in and sits. You can't actually make out any specific bump, and you just finish the surgery. Now we have, I think, the largest series of the Impress. We have, I think now it's close to 960 or 980. I don't know. That's what the company people gave the figure, but it's this is the figure of greater than 900 implantations. So 6.6 for distance 2020 to 2030 at 60 to 70 centimeters, we have gotten greater than 97%, which is a huge plus for a particular patient that is there. And the recommendation to the family would be close to 98% what these people would have. Friends, I would just say that this is a lens which does not cause any specific dysphotopsias. It does not cause any specific knowledge that you need to have for putting it. Furthermore, there are no specific contraindications that I take into account that this is contraindicated for this. Minor decentrations or tilts, etc., it is very forgiving for that particular part. And therefore, as Dr. Ram was saying, that his go-to lens is a multifocal lens, and then he takes out the exclusion. My go-to lens for anybody we are giving as a monofocal is no more a monofocal. I have totally, with the monofocal plus lenses, or whether it's be from this company or any other, that has cannibalized totally my monofocal practice. So I think, again, it's the same thing. Why do companies still make spherical lenses when aspheric lenses are better? So that's a question. They want to sell it cheaper, but I don't know what they get if they can reduce the price of the aspheric lens. The same they can do for a monofocal plus, and that becomes the standard of care then. So in my experience today, or in my practice today, a monofocal plus is the lens that I go for. Monofocals are almost out of the practice until, of course, there is some financial consideration or whatever it is for the patient not to afford. Very low PCO, glistening free, easy to put, etc. Results are outstanding. I don't actually talk to the patient as to what additional I'm going to give him. It's just let it be a wow factor. It's just saying that we are putting it, and there is nothing that I need to discuss with the patient. That's about it. At best, I can say that your plus ad, instead of going from a +3, normally the plus ad that we are getting is about 1.5 to 1.75 in the patients, and obviously everyone has their own. If you do a mini monovision, etc., majority of the time the patient can be spectacle free. So that's all that I wish to say about this particular lens. Thank you very much for your kind attention. Thank you.
Thank you very much, sir. Very nice talk. Indeed, Impress has become a very go-to lens whenever, patient is not a suitable candidate for a trifocal. The most important thing is that it does not require additional work of what is traditionally we are doing for a trifocal. And you showed another video, a video in that the injector was brought in, and it is one of the best injectors available in the industry.
Yeah. We discussed that yesterday. I feel it is really it's really a piece of cake. You can easily push it through. You don't get any tears or lens breakages or the things not coming. So I think from a injector perspective also they need to be complimented that it's a great injector system that they have developed.
Thank you.